topics, and we have experts in the house every week to deliberate and to inform and guide us all adequately concerning our health. And on today's edition of the program, as always, promises to be informative, educative, and interactive. Halfway into the program, our phone lines will be open for you to call in to be a part of the program. And when it's time, don't forget, kindly turn down the volume of your So, hand hygiene has to do with everybody. So you would not say, I don't have anything to do with what you people are talking about. Please stay glued to your TV sets and be adequately informed about how to care for your hands. And I've been joined in the studio this afternoon by Dr. Naka Joseph Nababa, a consultant with the Department of Medical Microbiology, Jos University Teaching Hospital, and he is representing the IPC chairman on today's edition of the program. Good afternoon, doctor, and thank you for coming on the program.
Good afternoon, viewers.
Right.
And thank you for having me here.
And I also have Nurse Christiana Gokir. She is a link nurse with the Jos University Teaching Hospital. Good afternoon, and thank you so much for coming on
Good afternoon, and good afternoon, viewers. Thank you for having me here.
All right. So, hand hygiene, what does it entail?
Hand hygiene, as the name implies, means cleaning of the hands to be safe enough for caring of the patient in the healthcare institution, and also for use in the community, especially when it comes to interacting with oneself and another person or the community at large. There are several ways where we can wash our hands or make them safe through cleaning. One of the ways is through cleaning with clean soap and water. And the water should be from a running tap. That is if the hands are visibly soiled. But if the hands are not visibly soiled, we can perform hand hygiene using alcohol-based hand rub. The entire essence of this exercise is to render the hands safe, to take care of patients, and not just patients, but to carry out activities that pertains our health at home, in the community, and in the healthcare institution.
Okay. So if you have water in a bowl and you're washing your hands inside the bowl, it's the wrong way to care for your hand.
Yes, it is very wrong to use water inside a bowl, because at the same time, whatever germs that is being washed off the hand is being returned into the bowl, and then that same bowl will be used to continue washing the hands. So at the end of the day, the hands are likely going to be contaminated again. So work done will be equal to zero.
Okay.
The most that can be done in such situation is to get a second person to help in pouring the water onto the hands. By that, there won't be recontamination.
Okay.
Yes. And some other instances, we've had Veronica buckets. The Veronica bucket has a tap. It's a local innovation that looks like a tap. That one too also helps in running water to be used in performing hand hygiene.
Okay. So, medical experts were saying clean hands save lives. Someone will be imagining, how will clean hands save lives?
Yes, clean hands saves lives. It's not a misconception. That is true about clean hands, because clean hands, when you have clean hands, you have protected yourself already from. Research has shown that from 99% of illnesses, because there are a lot of microorganisms that are in our hands. With our eyes visibly, we might not see it, but under the microscope, you see a lot of them. And with those same hands, because hands have connection with our mouths, whatever you get to eat, you use your hands, isn't it? So with your dirty hands, when your hands are not clean, you put your hand in your mouth. By eating anything, you are automatically introducing microorganisms to your system. And before you know it, they begin to affect your system one after the other. The individual becomes sick. At the end of the day, we're endangering the society.
Okay. So could you give us examples of infections that can be spread through the hands?
A lot of infections can be spread through the hands. Commonly among them are the gastrointestinal infections, those ones that usually present with diarrhea and vomiting. Now, these infections usually will be carried on the hands that are not clean and then put in the mouth, maybe through drinking of water or even eating of food. Even food poisoning too can also be gotten through by using dirty or contaminated hands. One that is very common and popular that even caught epidemic is the cholera, which is dreaded very, very most often, and we have seen outbreak of cholera. So that one too can also be transmitted with hands that are dirty and contaminated. Apart from that, even COVID-19, which the pandemic we witnessed not too long ago, it can also be spread by the hands. Of course, it is a respiratory tract infection, but then if the virus perches on any surface, let's say a table, or it is on somebody's hands, and then you shake that person or you touch that particular surface that has been contaminated, if the hands are brought into the mouth or through the nose, infection can happen. Don't also forget that most of the time we tend to clean even our eyes using our hands. Yes, exactly. So that can also encourage the spread of infections that affect the eye, like the conjunctivitis, which people popularly call Apollo.
Okay.
And then at the same time, not just infecting oneself, but somebody can also infect another person, especially during healthcare delivery. If the hands are not clean, it means they are not safe. And if they are not safe, then the patient that the healthcare worker is taking care of is not safe. The healthcare provider himself or herself is not safe. And then these infections can also be carried on the hands, probably, and taken back home. So that means that the entire community is also not safe.
Okay. So doctors and nurses come in contact with more than 10 patients, I would say, a day. So how do you now prevent yourselves from spreading germs and infections from one patient to the other?
Okay, there are various ways that one can prevent such infection. The number one thing is the use of hand sanitizer. If the water is not visibly available for you to use at that time, because sometimes it may be difficult, yes, seeing 10 patients or more than 10 patients in a day. For instance, in the clinic, you cannot be washing your hands immediately after observing a patient and then another patient when you have hundreds of patients waiting for you to see in the clinics. What we do usually is the hand scrub, that is the hand sanitizer, where we can use to prevent ourselves from those infections or infecting our patients. And another way is using hand gloves. This is another easy way also to prevent the patient and the healthcare provider from becoming infected with infections.
Okay. All right. So for hand sanitizers and water, which would you say is best for one to make use of as far as hand hygiene is concerned?
Okay, both method of hand hygiene, that is washing with soap and water and using hand sanitizer, as effective as they are both very efficient, but it only depends on the situation where one uses them. For instance, if the hands are visibly soiled, that is, if you can see any dirt on the hands, then that hand must be washed with soap and water. But if the hands are not visibly soiled, that means you can't see any dirt on the hands, then the alcohol-based hand rub can be used. Each one has its own rule, but I can assure you that they are as effective as the other. Okay. In fact, WHO has made it easier for healthcare workers to perform hand hygiene at particular moments It is called WHO's My Moment for Hand Hygiene. So before a patient is being seen, that is before touching a patient, a healthcare provider must perform hand hygiene. That includes examination of the patient where pulse rate, blood pressure, temperature can be taken, or even washing of the patient. The second moment where hand hygiene must be performed is also before any aseptic or sterile procedure. That is, if for instance the healthcare provider, let's say, wants to draw blood for any test in the hospital, he or she must perform hand hygiene. After contact with body fluid, or the risk of contact with body fluid. Now when we talk about body fluid, we talk about blood, urine, stool, and so on and so forth. So after contact with that, the healthcare provider must perform hand hygiene. And then after contact with the patient, the first one is before contact, and the fourth one is after contact with the patient. Then the fifth moment is after contact with the patient surrounding or environment. So in this case, we're saying that even if the healthcare provider has not touched the patient, but he has come in contact with the patient's environment, which may include railings, beddings, bed stands, even the patient's folder, or even the drip stand. In that case, the healthcare provider must also perform hand hygiene. And this is done every time a patient is to be seen. That is scientifically proven. It is evidence-based. It has reduced the rate of healthcare transmitted infections or healthcare acquired infections, as we've said it, more than 70%. So it is a very, very effective tool to prevent transmission of infection.
Okay. Viewer, if you've just tuned in, the program is Healthcare, and it's coming to you live on the TV arm of PRTVC. And in today's edition of the program, we've been talking about World Hand Hygiene Day with Dr. Naka Joseph Nababa. He is a consultant with the Department of Medical Microbiology, Just University Teaching Hospital, and he is representing the IPC chairman on today's episode of the program. And also Nurse Christiana Gokir. She is a link nurse with the Just University Teaching Hospital. So still to you, Dr. Naka. You spoke about washing hands in a bowl as a wrong practice. So for people that are in rural communities, that running water is not readily available, plus hand sanitizers possibly are not readily available, what would you advise people in that kind of situation to do, since washing hands inside the bowl is a wrong way to care for your hands?
In situations where there is no running water, one can still perform hand hygiene with a second person who will help in fetching the water in a bowl and then pouring it down for the other person to perform hand hygiene. But then the alcohol-based hand rub or the hand sanitizer has become so popular now that even in rural areas, you can still find them. And then some companies have made it in very small containers that wouldn't cost much to acquire. So I would still encourage people to try and get hand sanitizers for themselves. Yes, it is very, very possible. In fact, I have one here that is produced in jute, the pharmacy department. You can see it's even from my pocket. It is portable, and then it's exactly. So it's advisable that everybody should have one.
All right.
Yes.
All right. So, is there a time frame tied to washing of hands? And then possibly, if you could demonstrate, so we are sure we are washing our hands the right way.
Okay. Yes, there's a time frame for hand washing. WHO standard for hand washing doesn't take much time anyway, but in 20 seconds, ideally, you are supposed to wash your hands clean. In washing of hands, we have 5 moments of hand hygiene standard by WHO, and we have 10 steps of hand hygiene. And in the demonstration of hand hygiene, under running water, supposedly, or you are my assistant, supposedly we're in the rural area where we don't have water, or we don't have tap water where it can run through. As my assistant, you pour the water like this when I rub, I rub my hands, and then the hand wash, you pour it for me, or I press it, depending on where it is. If it is the type that has a press that one can use, you wash, you press it, you rub. I guess you can all see my hands, viewers. As you rub like that, you count like 1, 2, 3, 4. You go 1, 2, 3, 4. As you're washing the hands inside, you're also washing your knuckles with the thumb. All right? Then you come to the other hand like that too. 1, 2, 3, 4. The same thing. You now come and wash the thumb. 1, 2, 3, 4. 1, 2, 3, 4. You go to the back, you wash, and the other hand too washes the other.
Okay.
As you do that, you wash your fingers and the lines in between your hands.
Okay.
You turn and wash the other hand as well. Then the rings. All right?
Wow.
Then you continue the pouring of the water, and then your hands are clean. Within 20 seconds, you are done. And there's a formula for it. This happy birthday song, I believe since when we were kids, we all know about happy birthday song. So as you sing that song, happy birthday to you, happy birthday to you, happy birthday, happy birthday, happy birthday to you. Before you know, you are done. And your hands are clean, preventing you, your child, your family as a whole, the patient in the hospital, and the entire society within few seconds.
Okay. But if I am washing my hands the way you just demonstrated, but I don't pay attention to my nails, am I safe?
You are
Or
not.
you need to pay attention to the nails as well as the hands?
You are not safe because you've not really performed hand hygiene standardly. Because our nails carries a lot of bacteria that we don't see them. Because the nails harbors bacteria. So if you don't take your time, pay attention to the nails, you'll be carrying a lot of those bacteria. Even if you finish washing the hands the way we do it traditionally, you'll be walking around with bacteria on your hand.
Okay.
So it doesn't make one safe, because it's with those same hands you scrub your eyes or you put in your mouth.
Okay. So if you are around someone that is practicing poor hand hygiene, and you try talking to the person, making the person see reasons as to why he or she needs to inculcate the habit of good hand hygiene, and the person is proving stubborn, what do you do in that kind of situation, just so you also protect yourself?
Well, they say my people perish for lack of knowledge. That is according to the good book. In that kind of situation, it is very, very important that you get to educate the person on the importance of hand hygiene. Because I'm very sure if that person knows the implication of transmitting infection through the hands, he will listen to you. I would want to practice it the correct way. But then if you come to healthcare institutions, especially where I practice in Jute, we have a lot of posters and flyers that carries standard operative procedure on how to carry out hand hygiene. So that can be very, very useful. If the person is proving stubborn, then you can refer him to that picture, and I'm very sure that will help him a lot. And to also chip in on the issue of washing of the nails, especially for people that keep long nails, that is why it is advisable not to keep long nails at all. Especially for healthcare workers, our nails must be kept short so that it doesn't harbor germs under them. It's very, very difficult to wash under the nails. So we usually advise our nails should be kept short.
Okay. So aside the demonstration of washing of hands, is there anything you feel people that are not practicing good hand hygiene to start doing from this minute of advocacy?
Yes, that is why WHO have set aside this day to advocate for hand washing. the general public should know from this day, if at all they are not aware of it, that hand washing is very, very important. It will prevent you, your family, and the society as a whole from contacting those germs. So from today, if you are not practicing, or if you've not been practicing hand hygiene, I encourage you start doing that today. It will help us, it will help improve, improving our health. It will prevent us from infecting our family members and the society as a whole, and it will give us good health. And a society that is not healthy is a poor society already. So World Health Organization is advocating for hand hygiene to have a wealthy society.
Okay. So you are a medical doctor, and we know doctors and nurses 5 and 6 with hand gloves.
Yes, yes, yes.
And we believe that that's some form of protection against germs. So after the usage of these gloves, do you need to still wash your hands, since the gloves is a cover?
Yes, hand hygiene must be performed every day, anytime, and on any patient. But hand gloves can be used depending on the circumstances in which one finds himself. Now, the hands, as we know, or the skin generally, harbors some germs on them. There are some bacteria and some fungi that are there normally without causing any form of problem. But if one were to remove them from the skin, for instance, and say put them in the bladder or inside the blood, they cause problem. We call them normal flora. Now, these normal flora are categorized into two. There is the resident normal flora and then the transient one. And the transient one is found on the skin. Now, hand hygiene tends to reduce the amount of this normal flora so that it doesn't get transmitted to another person. So even before wearing of gloves, one must perform hand hygiene. And after wearing of the gloves, you carry out any procedure or intervention on any patient, you remove the glove, you must also perform another hand hygiene. Why is that important? Anytime gloves are worn and for some time, if you notice the hands become moist, they become warm, and that provides a very good environment for bacteria to multiply that is under the gloves. And if hand hygiene is not performed after removing them, they are a source of infection to the next patient. That is why even with glove, hand hygiene must be performed before wearing the gloves and after removing the gloves.
Okay. So are there modalities put in place to ensure that every health worker is practicing good hand hygiene before coming in contact with patients?
Now, one of the objectives of this year's World Hand Hygiene Day is, the theme is even action, save life. And one of the objectives is to urge healthcare workers to comply with hand hygiene. There is a WHO tool for hand hygiene compliance monitoring, evaluation, and feedback.
Okay.
That tool is meant to assess or evaluate the rate of hand hygiene compliance, and it follows the 5 moments of hand hygiene. So a particular word is usually chosen, and then if any healthcare worker enters that particular ward to see patients, then the tool comes into play. We notice before touching this patient, did that person perform hand hygiene? Before any aseptic or sterile procedure, was hand hygiene performed? After contact with body fluid or risk of contact with body fluid, was hand hygiene performed? After contact with the patient and after contact with the patient's environment. So we calculate the rate. It's usually in percentage. And if it is low, then of course intervention will have to be carried out. And this intervention is usually carried out in form of education That education can either be passive or it can be active. And then the next important thing again is, do facilities provide these equipment or structures for hand hygiene to be performed? Is there a tap and running water? Is there liquid soap? The hand sanitizers, are they provided? Now that is another objective of this year's World Hand Hygiene Day. To push for healthcare facilities, to provide adequate facilities for hand hygiene, and also to provide the necessary environment or the strategies or also the equipment that will be used to monitor this hand hygiene. And afterward, we'll now swing into action to encourage people, especially healthcare providers, to go with that. But then in the community, because we've been talking about the healthcare institution, there's also community-acquired infections. And these are the infections that we acquire in our places of work and also at home. So even at that period too, we also encourage for hand hygiene. For instance, before one cooks, before one prepares even ingredients for cooking, before one eats, must perform hand hygiene. After using the toilet, one must perform hand hygiene. After eating, one must perform hand hygiene. Even though it is not very important after the eating, the most important one is before the eating. But you know, a lot of people will assume that since my hands are clean, they are not visibly soiled, I don't need to perform hand hygiene. But I am telling you today that it is even more important, or it is the most important period for hand hygiene to be performed. These germs that we have been talking about are very, very tiny organisms. You cannot see them with your naked eyes. So one needs a microscope. And in fact, if you notice the magnification of the microscope that one may need to see something like a bacteria, it will have to be magnified up to 1,000 times before you can be able to see it. So you see, if you think because you cannot see any dirt on the hand, you can just put your hand inside the food and start eating, you are causing yourself harm.
Okay.
And we advise against that.
And my grandmother said she just had her bath, so there is no need to wash her hands before eating because she just came out of the bathroom.
There is still need. I can understand with your grandma, but there is still need for that to be done. As I have said, these microorganisms are everywhere. They are in the air. They are on almost every surface that we touch or we come in contact with. So you see, the need to perform hand hygiene cannot be overemphasized.
All right.
Yes.
Viewer, will be taking a very quick break, and when we return, the conversation will continue. Stay with us. Welcome back from that short break, viewer. If you've just tuned in, the program is Healthcare, and it's coming to you live on the TV arm of PRTVC. And this is where I get to say you can join us on the program by calling the number 090-61-910-190. I'll take the number again, 090-61 910190. Please, when you get through to us in the studio, don't forget to kindly turn down the volume of your TV set, or you move away from it so we can hear you. And don't forget, we've been discussing World Hand Hygiene Day with Dr. Naka Joseph Nababa, a consultant with the Department of Medical Microbiology, Just University Teaching Hospital, and he is representing the IPC chairman and also Nurse Christiana Gokir. She is with the link. She is a link nurse with the Just University Teaching Hospital. The number once again to join us in the studio is 09061910190. And of course, the numbers are on your TV screen, so please do well to call in. We would love to hear from you. All right, so the World Hand Hygiene was celebrated yesterday.
Yes.
Could you speak to us about how the day went?
It went well.
So we can also be carried along.
Yeah, of course. World Hand Hygiene went well in duty yesterday, where a lot of patients were seen in the clinics. They were taught on how to perform hand hygiene. They were educated about hand hygiene, and we had a symposium whereby health workers were trained or were educated about the importance of hand hygiene as well. And hand sanitizers were, of course, shared to people around. So if you were not there yesterday, you missed, of course. But those who were in the clinics yesterday will attest to that they got those little packs of hand sanitizers to keep their hands clean at all times.
All right. So aside the celebration that took place yesterday, plus this advocacy going on right now, is there anything the Nigerian Medical Association is doing to ensure that people are reminded on a daily on the need to practice good hand hygiene?
Yes, that is why the education or educating the public on hand hygiene does not only depend on World Hand Hygiene Day. We're taking this time to educate the public that wherever you find yourself, whichever day, wherever you are, hand hygiene is a paramount thing. That parents should teach their children whenever they come back from school, whatever they are doing, or whenever they come back from their playgrounds, whenever they open the door, just as Dr. Naka rightly said, of the toilet, the door knobs, because there are a lot of bacteria everywhere. So hand hygiene should be a practice that should be done every day, every time, and in fact every second, if the time permits.
Okay.
So there's no specific time allocated to hand hygiene alone.
Okay. So for someone watching and is in a rural area and still have this traditional belief in his or her head, and they feel, I don't need to use soap and water or hand sanitizer, I have my ash to do the job for me, is it advisable?
Well, we do not advise the use of ash to clean the hands. I've had people talk about that, especially in the rural area. But then this is an opportunity for them to be educated and also to have awareness on the importance of hand hygiene. Yes. Now, what we are talking about today, hand hygiene using soap and water, and then also using hand sanitizer. These are evidence-based and scientific approach. They have been tested and found to be true. Yes, these are not assumptions. I have not carried out any research on the use of ash to perform hand hygiene and to know whether it works or not. But I can assure you that these methods that we've been discussing here, they have been tested and they have been proven. In fact, I was at a training in Abuja sometimes last year where we were asked to perform hand hygiene. We wash our hands with soap and water, and after that our hands were swabbed and tested in the lab. And I can assure you that the amount of microorganisms that were found on our hands were very, very, very minimal, except for those that have not performed the hand hygiene properly. Even with the use of hand sanitizers, or what we call alcohol-based hand rub, we have tried that. We have asked people to perform hand hygiene, and afterward we took swabs, went into the lab, carried out tests, came out, and the number of microorganisms were very, very minimal. They don't pose any health risks, or they don't pose any risk of transmitting infection to another person or to a patient or even to oneself. So we usually want to advocate for strategies or interventions that are evidence-based and scientifically proven to be effective and efficient.
Okay. And then earlier you made mention of liquid soap. Must it be liquid soap or bar soap will also be good to go?
Well, we usually advocate for liquid soap. Why? Because you take a portion of the liquid soap and then you don't have to contaminate the rest of the surface. You would agree with me that where to place the bar soap is actually a challenge, especially where there is running water. You keep it there and then it becomes soaked in water. In fact, you see it looking dirty, haggard and awkward, and in fact, you wouldn't even want to use it again. But in situations where there are no liquid soap, then of course we will encourage that a clean and dry place should be used to keep that bar soap. But sincerely speaking, the liquid soap is better.
Okay. So, are there myths or misconceptions that our viewer out there needs to know about hand hygiene, or there are none?
Yes, there are a lot of myths out there. Someone will tell you that I just left my house now, or I've not touched anything. So why are you telling me to wash my hands? So my hands are not dirty. Simply because they don't see those hands or those swelled hands. But I assure you, just as he rightly said, those microorganisms are even on the air. So people that always think, no, my hands are not dirty, my hands are not dirty, I don't need to wash my hands. Or moreover, because I'm eating with spoon, I don't need to wash my hands. Not knowing that as you pick that spoon with your hands, taking it to your mouth, those germs are around the environment. But by the time you wash your hands, you have clean hands. You have a safer spoon to be able to eat with. And at the end of the day, you live healthier. Yes.
Okay.
Yes, another myth again to add is that, some religious entities take particular concern against alcohol. Yes, they might feel, we don't like alcohol at all. But we are saying that this alcohol is not getting into your mouth. It is only on the surface of the skin. And what it does is that it kills the germs that are on your hands. So they don't constitute alcohol use or abuse. So people should not be afraid or shouldn't feel bad when they are using hand sanitizers. Also, some people will also say that some perfumes will have alcohol in them. Yes, that is correct. But the percentage of alcohol in that perfume may not be enough to kill those germs that are on our hands. And so it is preferable to use the commercialized or the alcoholic-based hand rub that has been prepared specifically for hand hygiene.
Okay. Viewers, the numbers are on your TV screen. Please do well to call in. We've been talking about World Hand Hygiene Day, and it will be a great delight to hear from you. Please do well to call in. The numbers are on your TV screen. Right, so still talking about religion. Some people were actually two friends, and it was about the need to clean your hands. So the other person, she was telling her friend, even the Bible talks about the need to wash your hands, and even Muslims, you'd always see them washing their hands, cleaning, just to ensure that you are clean. So her response was, what's the connection between religion and hygiene?
They say, is it godliness is next, or is it cleanliness is next to godliness? Yes, yeah, exactly. Cleanliness is next to godliness. I think both religions have always emphasized the need for hygiene generally, not just hand hygiene alone. Exactly. I've had a lot of my friends who are religious talk about hygiene. Yes. So if one is always sick, how would he even want to practice his or her religious rights? You need to remain healthy so that you can do that. And one of the ways to remain healthy is to make sure that you don't get yourself infected. Because infections are very, very common. As I have said, these germs are everywhere. They are on the tables, on the surfaces, on our trousers, on our skin. on the floor, on our roofs. They are just everywhere, even on the surfaces of our cars. And most often, if there is any disease that people tend to come down with, most often are infections. And we are now saying that those infections can be prevented. In fact, more than 70% if hand hygiene is performed. It is not just only hand hygiene. There are other modalities. But for the sake of this week or this day, that is, the hand hygiene was observed yesterday, 5th of May. Everywhere we do, every year, yes, we do that. It started in 2009. This is the 18th year which we are celebrating World Hand Hygiene Day. And to also buttress the fact that it is not just only on the World Hand Hygiene Day that we are encouraged to practice hand hygiene, but it is just a day which is set aside to remind us, to urge us to continue to comply with this hand hygiene. And then at the same time, I think, this question is very, very important. Maybe next year we would have to even take it to our religious bodies. We'll have to invite our fathers in faith to have some interactions with them. Yes, I think religious leaders play a very vital role in dissemination of information and then also character and behavioral change. So I think this question is very, very vital. We would involve them next year or even before next year, so that we will have a broader health awareness on hand hygiene.
Okay.
Yes.
So if your friend is practicing poor hygiene and you want to speak to that friend, but you don't want the person to feel offended, is there a soft way you can tell the person to practice good hand hygiene without offending the person?
Of course, there is no normal individual that will want to get himself infected with a bacteria. So by the time, as a healthcare provider, trying to tell my friend about hand hygiene, yes, the first thing to do is health educating the friend about the effects or the danger of what he or she is doing. Because by the time the person knows the right thing to do or the importance of this hand hygiene, it will not be a difficult thing. So health education is key in hand hygiene to whoever. Because when you tell the person, you're endangering yourself, especially now that money is very difficult to come by. So when you tell the person that, definitely when you don't take care of your hands, you come down with a bacterial infection, before you know it, the person will definitely become afraid. Because normal paracetamol that we know that used to be 15 naira in the market or in the pharmacy store is no longer 15 naira again. Money is so hard to come by. So nobody will want to come down with any illness at all.
Okay. All right. Sanitizers, mostly alcohol based. And we have perfumes that have, some perfumes have alcoholic contents in them. So since hand sanitizers are alcohol based, can I substitute hand sanitizer with my cologne or perfume that has a percentage of alcohol in it?
No. That is discouraged, because there is a particular percentage of the alcohol that is used to prepare hand sanitizers, about 70 to 80%. So we will now ask, why would one want to use his perfume, which probably doesn't have that concentration of alcohol in it, to perform hand hygiene? So it is usually better to use the hand sanitizers that have been produced. And then at the same time too, there is a standard concentration or ingredient or level of concentration of the alcohol that is in this hand sanitizer. By the way, it is not only alcohol that is in the hand sanitizer. There is also hydrogen peroxide, which I'm very sure will not be in that cologne. So it is advisable that one stick with the hand sanitizer that has been prepared for that purpose.
Okay.
More on that perfume. Perfumes also have some chemicals that could be endangering the hands because they are not skin friendly per se. That is why perfumes are not meant to be on the skin directly. They are just meant to be on our fabrics. So by the time you use them on your hands, they endanger the hands.
Okay. The number to call is 090 61910190. Please do well to call in. It will be a delight to hear from you this beautiful afternoon. Right, so for our market women and people handling POS business, so at the business spots, possibly water will not be available for them to use their hands. And they are hungry. They're suya. What do you advise they do in that instance just so they protect themselves? Because coming in contact with money is a lot.
Yeah, exactly.
So definitely you've picked jams from that cash. How would you now, what would be your advice to them? Just so they don't take jams into their mouth via the suya or whatever they are eating.
Yeah, that's very, very important. That is why the pharmaceutical companies have made available pocket-friendly hand sanitizers, just like the one Dr. Naka just showed on the screen some few minutes ago. Yes, I wish I can have that so that I show them. So the little one that you and I can have it, even in your pocket, wherever you are, you can just place it on your table, on your POS table, wherever you are, in the small bag of the POS, you can have this little quantity of it. Whenever you want to use it, it's not heavy and it's not expensive. It's pocket friendly. You and I can't afford it. So we advocate or we encourage the general public. If you cannot buy the big one, you cannot get water around to wash your hands, you can get this one in this little quantity to be able to keep your hands clean.
Okay. And then I'm concerned about my gender. You know, we go to the salon a lot and to get our nails polished. And the same polish used for me will be used for you and the next person. So is there a possibility of transferring germs from my hands to your hands and to the other person via the polish?
Yes, there's a possibility that germs can be transmitted through the polish, because the polish will be kept open, and I am also sure that different people will come with different germs on their own hands, and that is why it is very, very, very important that whenever after using or applying the polish you want to eat, or anything that will make you to touch the mouth, put your hands in the nose or even in the eye, then hand hygiene has to be performed.
Okay. All right. So now to people that barb and to hairdressers. Is there any, the hand hygiene, is it applicable to them? Most especially hairdressers, you know, we get to wash the hair, so you are coming in contact with water, shampoo, and the rest. Do you still need to practice hand hygiene even after that? Seeing that there is shampoo to clean the hand and then water, do you still to wash your hand after washing someone's hair?
Of course, because there are a lot of bacteria on the hair. As we've been saying, bacteria are found everywhere. So on the hair, the fact that there's water, there's shampoo that you just use, but the hair has a lot of dirt. And we are talking about the percentage of alcohol in the hand sanitizer or the liquid soap we are using. In the liquid soap, different from that of the shampoo. So the shampoo may not really give you that cleanliness or that clean hands, because you're touching the hair, touching a client. I wanted to say a patient because we're used to patients every day. So touching a client's hair that have just come to you, you're touching bacteria already. So hand hygiene, practice at every moment. Whenever you come in contact with something, you wash your hands with clean water. using the hand sanitizer.
So the farming season is here. Farmers come in contact with lots of crops, fertilizer, insecticides, just so they have better yields. Are there extra hand hygiene practice they should imbibe? Because some of the chemicals might be too strong. Is washing of the hand okay to clean off your hands after touching all those chemicals and the fertilizer?
To the best of my knowledge, washing hands with soap and water will take care of that. Yeah, it can do that. Yes, it can wash off the chemicals on the hands. But then if there are some chemicals, agrochemical products that may not necessarily be able to be washed off with soap and water, then I would advise that we read the instruction or leaflet. I'm very sure that there will be instruction on how to go about that. But for the sake of infection, soap and water or alcohol-based hand rub would be okay. But definitely for people who are working in the farm, you would agree with me that there is no way their hands will not be visibly soiled. And so the use of soap and water would be advisable in that case.
Okay. So our phones are our besties. We are always with our phones. We drop the phone on different tables. We keep it in our pockets and different places. So do we need to wash our hands every time we come in contact with the phone, or we need to clean the phone every time we make use of it?
Yes, that's a major challenge in this AI generation that we found ourselves in. The phones, I assure you, if you should carry this phone to the microscope, examine the phone under the microscope, you see a lot of
Germs.
microorganisms
Okay.
on it. So it is advisable, once a while, you have the hand sanitizer in your pocket, you spray it on your phone, because these phones, our children at home play with them as well. Their tablets at home, they play with them, because we said microorganisms are found all over, even on the air. So when you keep it, those microorganisms will drop on it. So once a while, you drop your alcoholic based hand sanitizer on your phone to be able to keep it clean.
Okay.
And it will not be bad if you wash your hands after using your phone for a while.
Okay.
It will be good and it will help.
All right. So the slogan, disease no dey kill Africa. So no need to wash our hands. Africans are strong.
It kill Africa. If you come to the hospital and you believe me that disease dey kill Africa, please, let's not joke with our health. I know, of course, a lot of people have always said that. But then I can also say at the same time that in the days of ignorance, I'll leave it there. So please, don't.
All right. So your parting shots as we wrap up the program.
Well, clean hands save lives. And the action is always remember to clean your hands, whether with water and soap or with the use of alcohol-based hand sanitizer.
Okay. Nurse Goku,
Yes.
your parting shots?
Action saves life. Take an action today and keep yourself, your hands, and your environment clean and healthy.
Okay. And the network has been very, very funny. We're wrapping up and calls are coming in. Well, viewer, this is the much we can take on today's edition of the program Healthcare. Thank you so much for being there and for being a part of the program. Dr. Naka Joseph Nababa, a consultant with the Department of Medical Microbiology, Just University Teaching Hospital, and he is representing the IPC chairman on today's episode of the program. Thank you so much for coming on the program and educating our viewer.
You're welcome.
Right. Nurse Christiana Gokir,
Yeah.
Link Nurse, Just University Teaching Hospital. Thank you so much for coming on the program today.
Thank you very much, viewers, and thank you for having me too.
All right.
Plan Red.
Yeah. Viewer, this is the much we can take. Healthcare will be back on your TV screen next week, same time, same station, God willing. And a repeat of this edition will be aired on Monday from 11 a.m. till 8:12 noon. So please keep a date with us. On behalf of the entire production team, my name is Plangret Dabang. Thank you for staying tuned, and don't forget to practice good hygiene.